How's it going, everyone? I am Linnerwolf, and I'm here with Surgery Games on SurgerySquad.com. And we're going to be bracing this person's face straight up with some braces. Let's go.
Welcome to Surgery Squad. I'm Dr. Jeff, and today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth.
Those aren't even close to perfect teeth. Those look like two fingers pointing outwards, just pointing in two different directions. Like, hey, you over there, I'm pointing at you. My tooth is pointing at you.
Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech.
They're also great for getting stuck in other people's braces, getting food stuck in between your teeth, and not being able to eat certain foods.
Our patient today has what looks to be an overbite. We want to see how noticeable
Oh, hello,
it is.
Karen.
We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Oh, what is this I'm sticking in your mouth? I don't know, but I'm sticking it in your mouth anyways. Jam it in her eye. Just jam it in her eye. Put it up to her eye, and then do the thing. Oh well.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Why does the mold need to be flavored for it to work? Is that something we need? Also, this doesn't look like a mold. This looks like something you would grab someone by the nose with and just clamp onto their nose. Just like, I've got your nose. I'm not letting you breathe. I'm cutting out the circulation of air through your nose.
Great job! We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
Next week? You never get into a dentist next week. It takes like 1 or 2 months to go back to a dentist. Oh, nice music.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Okay. Make sure to get those gums as well. Can't leave out the gums. Gotta scrape that too. And the lips. Her lips are looking a bit chapped. This is great for moisturization. And her skin around the mouth is looking kind of dry, so we gotta put that on there too. Okay.
Wow, what a marvelous job. I can almost see myself in those teeth.
You can almost
We
see
need
yourself
to
in
put
her
on
face.
some molar bands to anchor the braces. They
This-
circle the whole tooth and have a hook on the outside of the tooth.
Those look more
Set
like
the molar band
medieval.
over the tooth. We'll cement it into place later.
Those look like more like medieval torture devices than dentist tools. These look like something you would put around someone's neck and then you twist it until they just... Or something you would clamp around like something like a brick and you would just twist it until it just broke the brick so you could have powder.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to
Oh
give us
god,
room
we've
to
given
work.
her dick sucking
Let's
lips.
rinse off the teeth. Can you spray them with water? I run the suction to remove the water.
Okay, let's just wash this. Wash this mouth. Make sure and hit that uvula with a good dose of water and air. Because that's definitely something our patient loves. Gotta also get back there in that throat. That dirty little throat of yours, Karen. Get the tongue. Make sure your dick sucking lips are nice and moisturized and hydrated. Same for your skin. Can't leave you out in the cold and dry. It's good for a facial, going to the dentist, you know?
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
I can. I don't have to, but I can. If you can figure out how to ask nicely, I will. Remember, we gotta hit that uvula with that air, pressurized air. Something everybody loves. Totally won't make anybody vomit. I'm a professional. Keep that in mind. Dry that face of yours, too.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Are we just taking like a scrub brush and putting Elmer's glue on our teeth? Are we doing a speed run? Surgery squad speed run. Surgery speed run. Sounds like such a great idea. Why has no one thought of it before? See how fast you can go through a surgery.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
These are ghost brackets because they vanish when you put them on the tooth and then magically reappear.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Let's flash the flashlight in her face. That's a lovely idea. Okay, we've
Great
done
job.
it.
Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch.
Why are we using cement in someone's mouth? And aren't we using it wrong? Aren't you supposed to just fill it up to the brim and then force the person's mouth shut so it dries like that? At least that's how I thought it was done.
The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
I like how I'm doing all of this with like psychic powers. Just watch me bend this with my mind to the right position. I'll bend this with my mind. Got it.
Good job.
See?
We do not want the wires
I'm a
to poke
psychic
our
doctor.
patient, so now that they
Professional.
are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers.
We get them at the dollar store for $99 and a pack of for $1.
Now you try. Place the ligature over the brackets indicated.
Let me just psychically do this too. I'm the world's first psychic doctor. Let's just leave the rest undone so that she needs to come back and we can charge her more for more work that she needs to have done. That's a little inside tip of information from one professional to another.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience...
Why is this woman so happy over like braces? I'm so happy about my new braces. I can't wait to have food stuck in them, and when I try to kiss someone, awkwardly get caught in their braces.
And some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on SurgerySquad.com?
I will see you in the next surgery. And here we are. Dental prophylaxis, aka tooth cleaning. I can pronounce that word because I'm a professional dentist and doctor. Of course. I got my license from a cereal box. That's how you know it's real. Let's go. That was quick.
Welcome to Surgery Squad's virtual dental prophylaxis. I'm Dr. Jeff, and I'll be assisting you with this procedure today. Dental prophylaxis, commonly known as a teeth cleaning, is a critical procedure in which a dental hygienist not only removes plaque and tartar from your teeth, but they can also instruct and demonstrate proper oral hygiene care. It is recommended that everyone get their teeth cleaned at least once every 6 months. If you're at a higher risk for periodontal disease due to age, tobacco use, or medical conditions such as diabetes or HIV, it is recommended that you have your teeth cleaned more often. Our patient today hasn't had a teeth cleaning in nearly a year, so they're certainly due for one. Let's put on our gloves and get started. Before we begin, would you like to learn about some common myths and misconceptions regarding general oral health?
Dr. Jeff, we are both very professional doctors and dentists. I do not need you to tell me about myths and misconceptions about oral health. I am well aware of everything you have to say. Thank you, but no thanks.
No problem. Let's get started. You'll need to measure the depth of the periodontal pockets around each tooth using a periodontal probe. The probe is inserted with light pressure between the tooth and gum. When
That
the
one must
probe is
feel
inserted,
so
it will
uncomfortable.
result in obscuring a section of the periodontal probe's tip. The first marking visible above the pocket indicates the measurement of the pocket depth. Measurements of 1, 2, or 3 millimeters generally signify that our patient's gums are in good health. But measurements of 4 millimeters or more indicate the presence of periodontal disease.
Okay.
Why don't you go ahead and use the probe to measure the depth of our patient's periodontal pockets? As you probe, I'll call out the measurements.
Let's just shove this into our patient's body without consent. We're just holding him down. Boom.
3,
That's good.
1,
Okay.
2,
Okay.
2,
Okay.
1,
Good.
4.
Oh,
Great job. I'll take it from here.
that was
3,
a 4.
1, 2. Based on the measurements, our patient could stand to floss a bit more regularly, but other than that, it appears that their gums are in good health. Now we need to remove the dental plaque and tartar on both the surface and below the gum line using a scaler.
Okay. This looks more like a sickle than a dentist tool, but okay, we're just scraping this across their teeth and getting the pee stains out. Why does our patient have pee stains on his teeth? Well, obviously it's because someone peed in his mouth. I'm not going to question what you do in the bedroom, sir, but when it comes to your dental health, I am the professional. And I say that you really need to not do this anymore, because it is hurting your oral hygiene. Let's scrape his tongue too, and his gum, and his lips. What's that? You think you're bleeding? No. I'm the professional here. I'll tell you when I think you're bleeding, okay? Okay? Good. We understand each other now.
These choppers are looking great.
Not
Next,
really.
we'll use our toothpaste to polish our patient's teeth. Toothpaste, known as prophylaxis paste to dentists, is a gritty substance that is applied using an angled attachment. This attachment is inserted into our handpiece. Which
Okay.
flavor of paste does our patient want?
What do you mean? You didn't tell me which flavor it is. And shouldn't we be letting him decide, not me? Let's just go with this one.
Mint, my personal favorite.
I feel like you would have said that regardless of which flavor we chose, but okay. Let's make sure to get his gums too. And his tongue, can't forget that in dental health. His lips are also severely underhydrated, so we'll be doing that too. The skin around his face is also really dry, so we should hydrate that. Okay.
Wow, that's fresh smelling. Now we'll use the water from our air water syringe to wash off the paste.
Okay. Now we're seeing some pretty good teeth. See, I told you I would take care of everything. Just leave your health in my hands. I'm a professional. Get that tongue. Rinse that tongue off. Give him his lips and gums some hydration as well. Good. Okay.
Don't forget the suction.
Can we just shove it in his eye? It'd be interesting to see what would happen. Would his eye just like get sucked out in a matter of seconds, just like, and just go through the tube? Or we could shove it in his ear and try to suck out his brains, like in those horror movies, those really bad horror movies. Okay, let's just shove it in. 1, 2, 3. Don't leave him any air in there either.
And finally, we'll need to floss the patient's teeth.
Fine, let's get to that. Good Lord, how much dust do you have between your teeth? Did you eat out of Granny? Did our ancient Fanny put some dust in your mouth?
Perfect. Their teeth haven't looked better.
Of course, I'm a professional.
We all know that we need to regularly brush and floss to keep our teeth and gums healthy. But what else can we do? Get a new toothbrush or change the head of your electric toothbrush at least once every 3 months. Over time, your toothbrush collects bacteria, and the longer you hang on to it, the more bacteria you're putting into your mouth. Obviously, you want to avoid foods and drinks that are high in sugar, but you also want to make sure you're not leaving out those that are high in calcium, vitamin C, and vitamin D. Foods such as apples, celery, raw carrots, and even popcorn can also help clean your teeth. So if you can't brush after a meal, eat an apple. Your teeth will thank you. Looking to keep your breath clean? Make sure you pick up the alcohol-free mouthwash. Mouthwashes that contain alcohol
will get you really, really high. Trust me. Don't drink it.
Can dry out the tissues in your mouth, causing them to become more vulnerable to bacteria. By cleaning your tongue with a tongue scraper, you're eliminating plaque and the pesky bacteria that can cause bad breath.
Dr. Jeff, I've already told this to our patient, dearie. I already scraped his tongue, thank you. A bit of redundancy is not needed.
As stated before, you should schedule a teeth cleaning at least once every 6 months. This not only helps keep your teeth and gums healthy, but your dental hygienist can help you reinforce good oral hygiene habits. These are just a few tips to help you maintain good dental health. Remember, keeping your teeth healthy is just as important as keeping the rest of you healthy. And that's a dental cleaning. Fantastic job! Let's see what else you can do on SurgerySquad.com.
I'll see you in the next surgery. Here we are with our next game. Let's go. Quick loading time.
Hello, and welcome to Surgery Squad's virtual teeth.
Who are you? Where's that other guy? That's what I was expecting. Is there more than one surgeon on this website? Impressive. Unexpected,
I'm Dr.
but
Susie,
impressive.
and I'll be guiding you through this procedure today. You no longer have to be a supermodel or a movie star to have a dazzling white smile. Just about anyone nowadays can get one. A wider smile looks healthy, plus it can improve your overall appearance and self-confidence.
Of course.
Our teeth become stained from coffee, tea, and other dark-colored liquids, and smoking certainly adds to the discoloration. A teeth whitening procedure can remove those stains caused by age and the things that we eat and drink. There are a variety of ways to do it. A whitening toothpaste or rinse, over-the-counter strips and gels, tray-based whiteners, or in-office whitening performed by a dentist. While the most obvious benefit is a brighter, wider smile.
Now what's that? Ancient Romans used urine and goat milk as a product to keep teeth whiter. Well, I can already tell you that neither of those things probably worked for them.
You do need to know that whitening is not permanent.
Of course
a whitening
not.
program, whether you do it yourself or have it done by a dentist, might not always lead to the results you want. If you have the whitening performed by a dentist, your teeth need to be in pretty good condition. Your dentist will also want to fill any cavities or replace older fillings before the procedure.
And you'll also need to remember that any fillings or such will leave inconsistent whitening effects.
In addition, a dentist will not perform the procedure if you have gum disease or your teeth have worn enamel. If you already have crowns or other restorations, the whitening will be inconsistent between those teeth and the others.
That's what I just said,
Our
Susie
patient
dear.
today is a
No need for
27-year-old woman
redundancy.
who has opted for an
Karen, you're back.
in-office dental whitening. She's a tremendous admirer of coffee, but she
I am a tremendous admirer of tea and coffee. That's like saying, I have a tremendous appreciation for alcohol.
wants to impress the folks at her 10-year class reunion with a bright, white smile.
Dearie, do you know that you can't have your teeth whitened if you've got braces? We just put those braces on you today, dearie.
So let's scrub up, glove up, and help her out.
Well, alright.
Our hygienist has already cleaned her
Okay, I saw you just earlier, a couple minutes ago. Your teeth were perfectly fine. And your teeth had braces. Can you tell me what happened? Did you get those braces removed as soon as I put them in? Well, that's rude.
teeth to remove all of the plaque. So let's start by matching our patient's current tooth shade with one from our shade reference guide.
You have definite A1.
Okay, we've got our starting shade. Let's see if we can make them more like this. First, protect your
anything
lips
would be
and
an
tongue by
improvement.
covering them with these rubber guards.
Let's just shove some contraption in her mouth to shut her up so she can't complain.
Nice work. Now we need to cover her gums and papilla.
Papilla?
The tips of her gums between her teeth with a
I
special
already knew
coating
this,
to protect
Susie.
them from the
I
risk of
am a
chemical burns
professional
when we use
dentist
the bleaching
after all.
agent.
And doctor.
Now, let's mix up our bleaching agent. We'll use carbamide peroxide, which is a powerful, reddish-looking substance. It turns into a stronger form of hydrogen peroxide in the mouth once we clean it off with water. That's when it takes off the stains. The mixture is ready, so let's get it onto her teeth. Cover each tooth evenly.
Alright. Da-da-dum, da-da-da-dum. We're painting someone's teeth a nice shade of red. La-da-da-dum. This is a lovely deep crimson. I bet it would look lovely on your lips. Of course, considering the effects it would have in bleaching your skin, basically. I highly doubt you would enjoy that experience. So let's not do that. I don't mind you. I hope you don't mind my humming in your ear. La-da-da-dum, da-da-dum. Should we just leave half of her mouth completely okay, I guess we're not gonna do her bottom teeth after all. Oh. Well, alrighty then. Suddenly we are. Don't know why we couldn't have done that in the first place, but here we are. Just got to be careful of what I hum, or I might get copyright striked. And I don't want that, considering this is my first video. How crappy would that be? Just like, you post your first video ever, demonetized. Copyright strike. Done. Ah yes, this lovely shade of crimson. Put some in our gums for healthier gums. That is definitely how that works. Oh, it'll be fine, Dr. Susie. It's fine. I am a professional after all.
We keep this solution on her teeth for about a half an hour.
Lovely music.
Let's see what kind of beautiful smiles underneath all of this red stuff. Take some water and gently wash away the carbamide peroxide.
Of course. Let's just wash this down her throat so she swallows all of this. It'll be fine. That definitely won't lead to stomach problems. I love how her teeth are coming out, though. They're lovely. I can't rinse the bottom ones until I'm done with the top, apparently. Make sure not to suction at the same time you're doing this, because obviously you don't care about your patient's well-being. Besides, we need them to come back. They'll have a problem with their gums, and then we can charge them extra for that.
Now with our dental pick, simply pop the protective coating from her gums.
Oh, we can do that? I mean, obviously we can do that. Let's just shove this under her gums. Oh, that comes right off. It's lovely. And we don't have to worry about her swallowing it either.
Great work! I'll take off the rubber lip and tongue protectors and see you back out in the waiting room. She's really gonna knock 'em dead with that bright smile of hers at her class reunion.
Yep.
But for now, her teeth will probably be sensitive for a few days.
Of course.
She should avoid extremely hot or cold beverages for the rest of the day and use a toothpaste made for sensitive teeth for a couple of weeks. She should also, as much as possible, avoid discoloring beverages like coffee, colas, or red wine for a few days.
That would be tremendously hard for an admirer of coffee, dear.
Smokes, well, now would be a perfect time to stop. This bleaching will most likely last for 2 or 3 years.
You know, you should just stop smoking anyways. Obviously, we're just going to tell you to stop smoking. Doesn't matter. Don't worry about withdrawal, you'll never have it. It's fine.
So she'll want to make this an ongoing part of her overall dental care. She should call her dentist if she feels a burning sensation in her gums or on her teeth that lasts for a couple of days, or if her teeth remain highly sensitive. You did a fantastic job today. While you're here, try your hand at one of our other surgeries available at surgerysquad.com.
I think I'm going to just scroll down past that part. But anyways, that's all for this time. And until my next video, leave a like if you like the video, subscribe if you like my channel, and share it with some of your friends if you think it's good. And I'll see you all in the next video. Bye!